Spokesperson Jess Brown-Fuller.
Thank you, Dr Morrison, and can I thank the Honourable Member for Strangford for bringing forward this important debate. And I'm particularly pleased to see the Minister in her place, which shows the Government's recognition that this is in fact a public health issue. Every drug-related death is a preventable tragedy. Every life lost represents not just statistics in a report, but families shattered, futures lost, and communities often left to pick up the pieces. So we do have a moral obligation, both as a government and as a society, to do better. The reality is stark, and that has been laid out very well by members across the House in today's debate, and drug-related deaths have reached record highs. These are not just the consequences of addiction, but often the result of inadequate support, stigma, as has been mentioned by many honourable members in today's debate, and a failure to adopt evidence-based strategies. In 2023, there were over 5,000 deaths related to drug poisoning registered in England and Wales. This is the highest number since records began in 1993, and an increase in 11% on the previous year. And my local hospital in Chichester is recording hundreds of A&E attendances every year where drug use is recorded. For too long, the response to drug use has been focused on criminalisation rather than treatment. But as honourable members have said today, we cannot arrest our way out of this crisis. Those struggling with addiction need access to healthcare, not to handcuffs. That means properly funding rehabilitation services, expanding mental health support, and ensuring that no one seeking help is turned away due to lack of resources. For me, Dr Morrison, this is personal. I have witnessed family members self-medicate with drugs when mental health support was unavailable to them, and my own dear dad battled with alcohol addiction throughout his adult life, and although it was a related cancer that took him in the end, the addiction had taken him away long before that. In fact, it's one of the many reasons I am proud to be a Liberal Democrat when we pledged in our general election manifesto to provide mental health MOTs at key points in our lives when we are most vulnerable to a change in our mental health. And I often wonder if my dad would still be here today had he ever had the opportunity to tell a professional that he was struggling. Dr Morrison, across the world, we have seen that harm reduction saves lives. I'd like to acknowledge the role that hardworking GPs, nurses, community pharmacists and other health professionals play in the support of access to medication and safe consumption spaces, which is taking an evidence-based approach and using it to prevent deaths. And in Scotland and Glasgow, as many members across the House have mentioned, where drug deaths are at crisis levels, pilots of safer consumption rooms are now underway. I was pleased to hear that my honourable friend from Mid-Dunbartonshire, along with other colleagues across the House, have visited these centres, and we should be looking at these models with open minds and not outdated ideologies, because the goal is simple. We need to keep people alive long enough to access their treatment and rebuild their lives. And as the Honourable Member for Warrington North said, the saving that we find across health and justice far outweigh the investment in centres that is needed. And we also need a joined-up approach across the country that lays out the most effective pilot projects so they can be further rolled out to other areas. The Public Accounts Committee identified in their report in February 2024 that there were delays in allocating funding of the 2021 drug strategy to local authorities and a continued lack of understanding about what works to prevent people from using drugs. It's unacceptable that there was a 14% underspend in the funding allocated to the strategy in 23-24 when it is clearly desperately needed across the country to prevent these deaths. And of course, prevention must also mean cutting off the supply of dangerous drugs at the source. We need stronger action against organised crime groups profiting from misery. That includes tackling county lines operations which exploit vulnerable young people and push deadly substances into our communities. Dr Morrison, this is not a partisan issue. We must work together across all of our benches to ensure that harm reduction, prevention and rehabilitation are at the heart of our national strategy, because at the end of the day, it's not about politics, it's about people, and ensuring that families do not have to endure the heartbreak of losing a loved one to drugs. At the core, it's about saving lives. Thank you.